Hi, good afternoon. My name is Aisha Fab, and this is my care coordination presentation to my colleagues. I'm a student at Capella University. This is my 4050 coordinating patient-centered care. My instructor name is Dr. Newton, and today is March 4th, 2022. First of all, I want to discuss care coordination presentation to colleagues. I'm just going to give you a short background of myself. I'm a registered nurse at the University of New Orleans Medical Center. Today, I will talk about the key standards of care coordination. I will incorporate local area assets, moral issues, and strategy gives that influence the planning of care. I will likewise examine successful, evidence based, and socially touchy systems for teaming up with patients and their families to accomplish wanting well being results. I will get the show going with characterizing what care coordination implies. As indicated by Okangabu 2017, care coordination is characterized as a purposeful association of patient consideration exercises between at least two members, counting the patient, engaged with a patient's care to work with a suitable conveyance of medical care administrations. The essential objective of executing care coordination is to overcome any issues between the patient and a multidisciplinary group. Care coordination permits patients to get great correspondence and stay away from divided consideration. The utilization of care coordination has been displayed to work on persistent fulfillment. At the point when individuals from the multidisciplinary group execute the utilization of care coordination, it assists the patient with staying away from slip-by in care, excess testing, as well as botched clinical treatment openings. In an article distributed by NEJM Catalyst 2018, expressed there are four components of composed consideration: essential consideration coordination, intense consideration coordination, post-intense long haul care coordination, and the present status of facilitated care. Alongside those four components, this article likewise records the components needed to have fruitful consideration, practical dexterity, which are simple admittance to a scope of medical care administrations and suppliers, great correspondence of powerful consideration, plan advances between suppliers, and attention on the absolute medical services needs of the patient and clear and straightforward data and patients can comprehend. Evidence-based care coordination. When giving consideration to patients, we also consistently guarantee we are rehearsing morally and ethically. Being a clinical supplier implies you ought to have a logical establishment, and with that comes giving evidence-based consideration. Evidence-based practice is made out of clinical mastery, patient qualities, inclinations, and best exploration proof. In an article composed by PSNet 2021, examines Project Boost, better results for more established grown-ups through safe changes, and Venture Red, which are proof-based mediations to further develop care coordination. Project Boost was created and tried by the Society of Hospital Medicine. This program utilizes normalizes devices to instruct patients about their release needs, test comprehensions of those requirements, and further develop medicine compromise at confirmation and release, according to Patient Safety Network 2021. The motivation behind this undertaking is to diminish preventive readmissions, further develop supplier work process, disease, decrease medicine related blunders, and get ready and enable patients, families, and parental figures. Project Boost has execution apparatuses that incorporate surveying patient danger for antagonistic occasions, later release evaluating the patient's readiness for progress out of the emergency clinic. Patient focused composed release directions instruct back follow-up calls, follow-up arrangements, interprofessional adjusts, post-intense considerations, changes, and drug compromise. These devices inside the patient safe release program will guarantee evidence-based consideration coordination is being given to patients all through their considerations. Let's talk about the change management. With the world in a steady condition of progress, it's basics that the medical caretakers can adjust and work through new executions. Medical services continually changing to address the issues of patients. Patients are living longer and requiring a more appeal of nursing care because of living with various comorbidities and complex ailments. Factors include expanding prioritization of medical services, quality across the six bases of productivity, security, patient centeredness, Adequacy, practicality, and availability has led to speed up change both in take up of drives and the acknowledgement of their results to meet outside targets, according to Harrison 2021. In a review by Harrison, a review was directed utilizing the Lewis model of change. This change model includes three stages, like thawing, changing, and refreezing. Thawing is perceiving a requirement for change. Change is the point at which you plan to execute change. Also, refreezing is when changes are supported and balanced out. In this review, Lewis' model of change was carried out to improve bedside handover of the movements between the nurse and staff. Like the bedside report. Thawing is the stage that while acknowledging patient fulfillment scores were down relating to bedside shift report, there was a requirement for change and improvement. Refreezing was utilized when cycling approaches were changed and refreshed. When the refreezing stage was in actuality, patient fulfillment scores expanded from 75 to 87%. The Lewis model of change was demonstrated to be viable with working on tolerant fulfillment. Role of ethics and care coordination. Patient consideration is affected by an attendant's encounters and abilities. The nursing code of morals assists attendants with an establishment of realizing what is ethically good and bad. As per the ANA, which is the American Nurses Association of 2015, attendants utilize the code of morals for completing nursing liabilities in a way steady with quality in nursing care and moral commitments of the calling. The Nursing Code of Morals is comprised of four fundamental standards: independence, value, equity, and non-pernicious. Independence is characterized as the patient can settle on their own clinical choice. Usefulness is characterized as the medical caretaker having the patient's well-being as a main priority. Equity is characterized as treating patient without predisposition and giving equivalent consideration to all. And the non-evil is characterized as not to make hurt the patient, meaning we're not going to hurt the patient at all, according to Bajani 2017. Joining the Nursing Code of Morals and the Lewis Change Hypothesis will permit medical caretakers to give evidence-based and moral consideration coordination to patients and their families at the point when care coordination is being given. The Code of Morals is dependably maintained. Care coordinations has been demonstrated to have better quiet results. Advantages assumes a major part in care coordination because of medical attendants are guaranteeing the patient can get the most secure and most coordinated nursing care, departing the patient without harm. Let's talk about the effects of policies on care coordination. Strategies set the establishments for conveyance of safe and practical considerations. Strategies are additionally executed to guarantee patients are getting bound together. Nature of care. An illustration of a strategy arrangement that impacts the coordination of care is the Affordable Care Act, otherwise called Obamacare, was passed in 2010. The strategy was placed into impact to give reasonable medical care to general society. The ACA likewise guaranteed patients wouldn't be denied protection, inclusion for prior conditions. Clinical suppliers couldn't deny treatment since somebody didn't have health coverage, according to Gaston 2017. An article composed by the AHRQ 2016, which is the Affordable Care Act, set out open doors to plan and test new models of care conveyance and installments that further develop care coordination, prompting further develop well-being and medical services quality and diminish spending. Responsible Consideration Association's model explicitly organized to further develop care coordination, join a patient suppliers from across the medical care conveyance framework with the shared objective of forestalling clinical blunders and guaranteeing that their patients don't get superfluous administrations, according to the Office of Health Research and Quality 2016. Nurses' role in care coordination. The ANA states enrolled attendants' commitments to mind coordination have for some time been a center proficient norm and capability for RNs. It is nurses' specialty. It is the thing that we have consistently done. Attendants shuffle many caps. Attendants coordinate consideration with the interdisciplinary group. Lead safe patient handoff reports. Show patients and their family meds and release and consistently guarantee patients' consideration is directed by quiet requirements and inclinations. In conclusion, care coordination is basic in giving top-notch patient consideration. Planning patient-focused consideration isn't just a monastery yet. In addition, an obligation by medical care experts must oblige to you for the setting aside the effort to pay attention to show have an extraordinary day. My references include Agency for Healthcare Research and Quality, ANA 2015, ANA 2021 by Johnny, which is the evaluation of adherence to ethical codes, Gaston Affordable Care Act, Harrison, Wapola, Shohan, Babola, Mears, and Ladois, where do models for change management, improvement, and implementation meet? Catalyst, what is a care coordination? Okangabu, Meredith, Shane, Simon, Stockdale, and Rubenstein, care coordination and provider stress and primary care management of high-risk patients. Patient Safety Network, follow-up care agency, and 10 ways the ACA has improved healthcare in the past decade. Thank you for watching my video. Have a blessed day. Bye.